Hi, everyone. My name is Megan Carvis, and my flashcard presentation is on glaucoma for this week. As you know, glaucoma is a disorder that occurs within the eyes as we study this week's disorders and on eye disorders, specifically damage to the blood vessels within the eyes and the optic nerves. Most individuals who are diagnosed with this disorder can result in vision loss and eventually blindness if not treated correctly. And loss of vision, unfortunately, is irreversible and there's no current cure for it. There are several different variations of glaucoma we'll talk about. Today we're going to talk about chronic, or known as open angle, narrow angle, or congenital glaucoma. So this diagnosis usually should be diagnosed early to assess intraocular pressure, which we will talk about later on. And because there's no cure for vision loss, it's important to diagnose early so they can manage the intraocular pressure. This can be managed by administering eye drops or taking medication or even surgery. And it's important to educate patients with this disease. So we're going to talk about the pathophysiology. It's a little more in depth. The most common, we'll talk about open angle glaucoma. Again, this is when occurs with age, as the aging process. The optic nerve becomes more damaged. You have this fluid in your eyes called the aqueous fluid. It's very essential for the eye. It manages the structure and nutrients of the interior portion of the eye. Most of the fluid is drained by a little drainage system called the trabecular meshwork to maintain the pressure. Normally, the intraocular pressure is between 15 and 21. And as the drainage canal becomes clogged at any point due to any trauma or aging process and any anatomy changes to the eye, basically that pressure is going to increase above 21. And that helps with diagnosis as measuring the pressure. Individuals don't really experience vision loss at first, but will notice over time, again, with aging, it's more of a slow, gradual progression with open angle glaucoma. Another diagnosis of glaucoma is angle closure, or known as narrow angle. This one happens more quickly. It's a more of an acute diagnosis of glaucoma. Instead of a gradual progression, a quicker progression can lead to blindness quickly if not acted upon. The trabecular meshwork becomes strained, resulting in, again, closure, and the pressure increases rapidly. And that can be due to many risk factors, which we will talk about. The risk factors are based on different diagnosis of glaucoma. Again, chronic is with aging, so any individual above the age of 50 can be at risk for glaucoma. And then, of course, with narrow angle glaucoma, the more acute one, it can be due to multiple factors in a person's life. If they have an infection in their eye, if they have any trauma, if they have any abnormalities, scar tissue, any of that scar tissue in the eye, the anatomy structures are changed and can block that aqueous humor from leaving, which increases the pressure. And of course, anyone who's at risk, who has inherited congenital glaucoma disease through autosomal or recessive traits, they can basically be born with glaucoma. We have seen it like in younger children as well. Signs and symptoms are often difficult because glaucoma is asymptomatic in the early stages. So, of course, if someone's not going to eye appointments or not attending their primary provider, not seeing their primary provider, vision loss obviously cannot be recorded. So it's important to attend those appointments. So loss of vision occurs gradually over time for that glaucoma. Basically, vision loss, blurry vision, and then as we get into the more progressive glaucoma, you can see general appearance, viewing of halo shapes over near bright lighting. So there will be like halos around the pupil when they're near bright lights. And of course, with the more acute glaucoma, pain in the corneas is another symptom as that pressure increases. Diagnostic testing. So again, as I said, can be diagnosed with their routine vision screenings when they have changes or loss of vision. But then they need to assess the optic nerve, which requires a more in-depth type of diagnostic testing. This would require a retinal fundus imaging by an ophthalmologist. The imaging diagnoses several eye disorders, including glaucoma, but the optic disc must be assessed for see if there's any erosion or what they call cupping. If they appeared cupped, they could be at risk for optic nerve damage. So that's why it's important to attend those and receive that imaging throughout the diagnosis of glaucoma, because they want to monitor the progression of the cup to disc ratio, and they want to monitor the intraocular pressure as well. And that is my flashcard for this week. Thank you for watching and have a good week.